When to use formula milk over breast milk. In certain situations, like for example, if your child is premature, preterm, or underweight, it is ideal after some time to start using formula milk to help them gain weight. Formula milk has extra calories, it has sugars, it has glucose, it has lactose, it has things that help your baby gain weight, which unfortunately breast milk does not. Of course, breast milk has its own benefits versus formula, but if you're trying to help your child gain weight, you might want to consider adding formula to their already breastfeed diet. Assalamu alaikum ji, this is Dr. Nida Badar. I'm pediatrician and neonatologist at National Hospital, DHA Lahore, and also my own private clinic in Model Town by the name of Tots and Teeth. Today's topic is a very good topic. It's breastfeeding versus formula feeding. Especially for new mothers that come in, their main concern is not having enough breast milk or mother supply and having to switch to formula. So I'm here today to talk about the myths and issues behind formula feed versus breastfeeding. Stay tuned. The first question today in this segment is, what are the benefits of mother feed or breast milk? Of course, the best benefit that we can give our child is when your child is born, they have no immunity, meaning that their body cannot fight any kind of infections, viruses, pollution, dust, anything from the outside world since they've never been exposed to it. So we have to build that. And mother's milk or breast milk has enough antibodies coming from the mom or your body to your child to help them fight any kind of infections now or in the nearby future. Until they start getting their vaccinations, it is the best method to make sure your child is safe from anything in the outside world. So the next question is that, does formula milk have the same benefits of breast milk? No, it does have added benefits like sodium, chloride, zinc, iron, vitamin D, calcium, and also some probiotics, but breast milk has antibodies, which some new formulas like Similac and Infamil have added. However, most formulas do not have antibodies. So therefore, the benefit that your child is getting from your milk outweighs what they get in the formula. So the next question is, when to use formula milk over breast milk. In certain situations, like for example, if your child is premature, preterm, or underweight, it is ideal after some time to start using formula milk to help them gain weight. Formula milk has extra calories, it has sugars, it has glucose, it has lactose, it has things that help your baby gain weight, which unfortunately breast milk does not. Of course, breast milk has its own benefits versus formula, but if you're trying to help your child gain weight, you might want to consider adding formula to their already breastfeed diet. So another very common question that especially new mothers are concerned about is, does formula milk cause issues in your child's digestion? To be honest, yes, it can. American Academy of Pediatrics and myself also recommend that a child should be 90% breastfed and 10% formula feed. Formula feed is of course heavy. It has things that your milk does not, such as lactose. So breast milk has about 2 to 3% or sometimes 10 to 15% lactose, and formula milk is anywhere between 45 to 50% lactose. So that 30-40% difference can sometimes cause your child to have indigestion issues, to have colic, to have constipation, or sometimes even alternate with diarrhea plus constipation. So yes, in certain situations, formula milk does cause indigestions, but remember, there are a lot of benefits that you're giving to your child that your milk does not have. So the best way to prepare your formula milk, I usually tell mothers, now this is just a personal trick that I have learned over my years, it's to use distilled water or bottled water, boil it just to be on the safe side, and have it placed separately for your child in a thermos or a hot water bottle or something. Have the water at room temperature, not too cold, not too hot. Try to mimic the same body temperature that breast milk is. So breast milk is slightly on the warmer side. Also, you can mix about, depending on what your child is taking, but for a newborn, for example, they usually take about 1 ounce of formula every 1 hour. Or according to AAP, which is American Academy of Pediatrics, it's 2 ounces every 2 hours. If you're giving more than that, you might be overfeeding your child. If you're giving less than that, then that means that you might want to increase your child's feed. So another very good next question is for a newborn, is formula milk better or breast milk? Ideally, of course, breast milk is better because, like I mentioned before, your child has zero immunity. So meaning that, God forbid, if they get an infection from the outside world, their body cannot be able to fight it off. So initially, you definitely want to try whatever you can to give your child as much breast milk as they can. Ideally, after about 4 to 6 weeks, when they start getting their first set of vaccinations, that is introduction to the body to new types of vaccines. So their body knows how to start fighting infections. But until about 4 to 6 weeks of life, definitely give your child as much breast milk as you can. Another very common question that new mothers ask me is how often or how much breastfeed should I give my child? That's actually a very difficult question for me to answer sometimes, even for my patients. So I tell them, usually what it is if your child is sucking on for about 10 to 12 minutes consecutively, they are getting about 1 to 1.25 ounces of breast milk. Ideally, if you can pump it and put it in a feeder and then give your child breast milk, that's the best way for you to track how much they're taking. But you do want to give them directly from you because that adds on bonding of your child. It makes your child less colic and just a sense of motherly bond and love happens. So 10 to 12 minutes of consecutive feeding is 1 ounce. So if your child feeds for about 20 minutes and then they sleep and then they wake up and then they feed again for 5 minutes, that ends up being about 25 minutes, meaning that your child is getting about 2 to 2.25 ounces in that time frame. Another very common question is at what age should you start your child on formula milk? So if you base it off of the internet or American Academy of Pediatrics, your child should be exclusively breastfed until 6 months. Now, I, in a personal experience, feel like your child should not be exclusively breastfed till 6 months because what happens is when you start to try them on solids, they will become very constipated, have a lot of gas issues, and have a lot of indigestion. So my rule of thumb is 6 to 8 weeks. After that, you just start a little bit of formula, meaning just 1 to 2 feeders in a day. The rest, 90%, would be your milk or breast milk. Another myth that I'm going to talk about is if your child does not get breast milk, is it a problem for them? And when can you give them formula milk? So listen, we shouldn't be very judgmental about new mothers or mothers in general who are having difficulty with producing their own milk. You have to realize that after pregnancy and childbirth, your body goes through a lot of mental and physical strain. So your hormones are all up and down. If you're not producing enough breast milk, it is not your fault. I feel like culturally, we tend to blame mothers for not being able to exclusively breastfeed their child, not realizing that the mother, it's not in her hands sometimes. So that is pretty much why formula milk was invented, is that if mother is having difficulty feeding her child, there needs to be a good substitute, a healthy substitute, to give your child all the nutrients and the proper diet that they need. So sometimes we've had cases where a child has had to have formula since the day they were born, right away in the nursery, and that's okay. Please don't freak out about that. It's a normal procedure, it's a normal process. It can take time to happen, and sometimes it doesn't happen, and that's why this formula was made, because it's a safe alternative for your child. So another question that I get asked very oftenly is, can I give my child milk from the day they are born? Of course you can, especially formula milk. Like I said previously, if you're a mother that's struggling to have her own milk production, your child is so safe having formula milk. They would never make formula to harm your child or its body. They understand that a child's digestive health, growth, and mental health is all dependent on their diet, which ends up being almost 100% only formula or breast milk for up until 6 months of their life. So these formulas are safe. Please stop believing all the myths that you hear and realize that it's better to give your child good, safe something option like a formula milk rather than making sure that they don't have any milk at all. Another good question that I'm asked is if my child is not taking breast milk and after some time they stop to take formula milk as well, what is the next best option? So this is a hard question to answer because normally up until 6 months, you're supposed to be exclusively either breastfed or do a little bit of formula and breast milk. After a certain age, when your child is having more growth, they're able to sit up, they're able to be more active, you can give them small little amounts of semi-solid foods such as Cerelac, custards, baby food, purees, things like that. That is another topic that I'll talk about later, but those are another options that you can give to your child if they're refusing to take formula milk or breast milk at that time. If you enjoyed this video today, liked all the topics that I talked about, and are a new mother who's still confused about breastfeeding versus formula feeding for her baby, do come visit me. You can make an appointment with me at healthwire.pk or on the number given above. Also, please like, comment, and share, and subscribe to the Healthwire channel for more updates.